welcome. This is our special edition on Dr. T. I'm Dr. T and this is Dr. Sireci. And today we're talking about, the benefits of putting sunscreen on, skin health in general, and what to do when you're out in the sun.
Today, our guest is Mrs. Smith.
Hey, Mrs. Smith.
Hello, Mrs. Smith. How you doing? It's good to see you. I'm glad that you're so concerned about your skin health. It's important that patients pay close attention to observe anything out of the ordinary.
Hey, doctors. I came in today because of my skin. Recently, I have been noticing how much my skin is changing over the years.
Well, how much time do you spend in the sun, Mrs. Smith?
A decent amount. My whole life, honestly. During college, I was a lifeguard in Hollywood. And then once I met my husband, he introduced me to mountain sports.
Really? Like what kind of mountain sports?
Lots of skiing and mountain biking.
This could do it. It's important to use sunscreen while partaking in activities in the mountains.
Wow, I never thought of that. And on top of that, I spent countless hours in the sun raising my two sons. My oldest is really into golfing and is always in the sun.
Well, we can give you some advice for him too.
Thank you, doctor. But really, why has my skin changed so much since I was 17 and still in high school?
Well, Miss Smith, there are many factors to that question. It's mostly caused by loss of collagen and elastin. That is actually what leads to wrinkles. Not only that, but your epidermis loses lipids, which can dry out your skin and also lead to wrinkles.
Wow, so is this natural?
Yes, it happens to everyone. There are ways to prevent further problems though.
My skin has started to have darker pigmentation. What are these and what causes them?
Well, these dark pigmentations don't look serious to me. They seem to be hyperpigmented skin. This is caused due to too much melanin being produced. Once cells become damaged, they can unfortunately produce more melanin than normal.
What?
Now these damages from your skin can be caused by sun exposure, too much iron intake, or a history of skin inflammation. But these dark spots do not look anything serious to me. Nothing out of the ordinary.
Wow, good. I was nervous about that. Now, when I think about it, when I was younger, I used to tan with baby oil. What SPF does that have?
Yes. Most people did that in the 80s and 90s. That wasn't your best idea, Mrs. Smith, because baby oil actually does not have any SPF. It actually can damage your skin, which can be partially the reason for having your dark pigments.
Wow, so what actually is SPF?
SPF is the ability to block out ultraviolet B rays. Now, ultraviolet B rays can cause sunburn and also skin cancer.
As a lifeguard, I always used to work 3 to 8 hour shifts. Was this dangerous shift? And should I have worn sunscreen?
Well, you should wear sunscreen every time you go out in the sun, Ms. Smith. But it's not extremely dangerous for the UV rays. The most important time to wear sunscreen is from 10 a.m. to 4 p.m. So there's an hour in there that there is essential to wear sunscreen.
Now what about the UV blocking shirt? Should I buy them for my kids? Do they actually work?
Before the break, Mrs. Smith was talking about, UV blocking shirts. And that's a great question. These shirts are effective and do work. All my patients have gave me great ratings and they did help prevent sunburn. Although they say this, after 5 to 6 washes, they become less effective.
Now the moisturizer I use on my face is SPF 15. Is that enough?
Honestly, Ms. Smith, that really isn't enough. It is not the best protection, but it's better than nothing. I would personally recommend SPF 30. That would suit your face perfectly.
Okay, thank you. Now my sister, who's not outside as much as me, seems to have less wrinkles. What is the reason for that?
Welcome back to this edition of Dr. T, here with Dr. Sireci and Mrs. Smith. Before the break, we talked about Mrs. Smith's sister, and Mrs. Smith was wondering why, she has so many wrinkles compared to her sister. Let's welcome in her sister, Maria Torres Smith. How you doing, Maria?
I'm good,
Hi, Ms. Smith. How are you?
I'm good.
So, Maria, we have your sister here, and she was wondering, why she has so many wrinkles compared to you.
Well, I was wondering that myself. Can you please tell me why?
Well, it's what we said previously with collagen. Her cells were probably not damaged. Your cells were probably not as damaged as bad from the sun to her, and her production of collagen and elastin. So what we're basically saying is, your sister over here has had more exposure to sun, and she didn't wear the proper amount of sunscreen with SPF. In turn, this causes her wrinkles and everything to be, the process to speed up a little bit.
Well, thank you for the information. Now I want my son to explain to you how much time he spends in the sun and what he should do.
To Mrs. Smith, and we're talking to her beautiful sister Maria Torres. I'm here with Dr. T and Mrs. Smith still, and she has some questions about her son. Let's welcome in Mr. Ryan Smith, the golfer.
How you doing, Ryan?
How you doing, Ryan?
Good to see you, buddy.
So I'm a golfer, and I'm on the golf course every day practicing my strokes. And as you can see, I have fair skin. So what can I do to protect against that from the UV light?
Well, the most important thing to do is to apply sunscreen. With your fair skin and your gingerish hair, it's important that you do this every time you go out to golf. No matter what the weather conditions are, you should always be wearing it. Even if it's cloudy, you can still get sunburned.
Wow, so you still get sunburned from cloudy days? I actually guarded those days.
Yes, it's important to always wear sunscreen, even in the cloudy days when you least expect it.
Thank you so much, doctors, for being so informative about my skin. You are a tremendous help.
Yes, thank you very much for telling me how to protect against my skin.
You're welcome, guys, anytime.
Glad we could help. This ends our special edition of Skin Safety and Prevention when you're outside. Thank you, everyone. This is Dr. Sireci, this is Mrs. Smith, and this is the ginger, Mr. Ryan Smith. Thank you, everyone. Have a good night.